Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. A remarkable procedure uses the power of sound to burn a tiny part of the brain, curing essential tremor in the process. For Rita Sievert, it was the answer to a lifetime of uncontrollable shaking.
I was 10 years old. I was walking in a park at a field trip at school and was walking back to the bus, and all of a sudden my hand just started jiggling.
That was nearly 6 decades ago, and Rita Sievert remembers it like it was yesterday.
I thought a monster had gotten into me.
Years would pass, school, marriage, even children came, before Rita, around the age of 35, would decide to face the symptoms she had tried so hard to hide.
Definitely the shaky hands, but also just anxiety. I would be afraid to go anywhere where I needed to hold a cup or be out in front of people.
Doctors would eventually diagnose Rita with what's called essential tremor, a condition that affects the nervous system and causes shaking, usually of the hands. You can see here just how bad it had gotten over the years. Rita researched options and chose the University of Kansas Health System and neurosurgeon Dr. Jennifer Chang.
Dr. Chang is the best. They told me she was a perfectionist, and I agree, and I think that just calms you down when you know somebody is going to make sure they get it absolutely right.
Dr. Chang used focused ultrasound, a minimally invasive procedure that targets and destroys a specific area of the brain that causes tremor in the hand.
I had my first hand done in 2021, right during the pandemic.
The procedure reduced Rita's tremor by 95%, and recent FDA approval cleared the way for her other hand.
I play piano. I'm sewing again.
Finally getting Rita back to the life she had long put off. And we are so happy to have Rita joining us from her home in Wichita this morning. Good morning, how are you?
I'm just great. Thank you for having me.
Well, good. Thank you for being with us and sharing your story and your experience. We want to also join with us in studio this morning Dr. Jennifer Chang, a functional neurosurgeon here at the University of Kansas Health System. She's going to really help explain how focused ultrasound works. Always great to have you here with us, Dr. Chang.
Thank you for having me.
Good to see you. And Rita, you have been living really with essential tremor for decades, as we just heard in your story. Were you doing anything to try to control the symptoms through the years, and what were they?
I took propranolol, was the medicine they suggested, and I started at 10 milligrams. I ended up at 360 milligrams a day, and it wasn't working.
Wasn't working. So how was this impacting your daily life? What kind of limitations were you experiencing?
Everything, like you see, eating, typing. I couldn't even write my signature. I gave up wearing makeup and playing the piano. I really became isolated. I didn't want to go out without my husband. I didn't want to go to restaurants, and I actually had to retire from my job.
So this was, I would imagine, affecting mental health as well, right?
Oh, absolutely. You just too much.
Yeah, you don't think about the isolation and just the things we take for granted, just being able to go out in public. How did you learn about focused ultrasound? I understand you were doing a lot of your own research at one point.
I really was. I had access to online, and I found the International Essential Tremors Foundation in Lenexa, and I found the FUS had started in Israel and slowly came to the United States, and I was so happy to find when it hit at KU Med. And I thought that was the treatment for me, and I just went for it.
Then you come here to the health system, you find Dr. Chang. It's nice, Dr. Chang, when you have somebody who comes kind of already equipped with some good information and lots of good questions.
Yes.
So really help explain how this all works. And we have some video of someone going through the procedure, and it's nice because it starts with a good old-fashioned haircut, a little free haircut to go along with it.
So, right, we first clip all of the hair on the patient's head because hair would interfere with the ultrasound waves. So the ultrasound waves are arrayed in somewhat like a helmet that is aimed at the brain. So here you see the surgeon placing a frame on the patient's head. So it looks a little bit like a halo frame, but there's 4 pins that hold the frame in place, 2 in the front, 2 in the back, that holds your head steady during the case. And then you see that this thing is actually called a membrane, what they're placing on the head now. But this is something that helps basically hold the water off the patient's face, because when the patient goes in here, where they're going to get positioned on the MRI table, like you see there, there's the helmet. So you see that round thing that's above the patient's head, and the ultrasound waves are generated within the helmet, and then all of the waves are aimed at the target within the thalamus, which is near the middle of the brain. And the ultrasound energy can travel through water, through the soft tissue and the bone, and into the brain. And then when it intersects and focuses on that spot in the thalamus, it heats the tissue up and recreate a lesion that treats the ultrasound by doing that.
So while the patient is in the MRI, you then are behind a window and you're watching.
Correct. Yes.
What are you doing and what are you observing during this time?
So during the procedure, we do imaging like MRI to develop the target, and then we have the ultrasound focus at the target to try to heat it. And while the MRI runs, we can see what the temperature of the brain tissue is. So it's important that we're kind of watching in real time and we're seeing the temperature rise and fall. And based on that, we can tell how much needs to be done, like how hot we need to go. And we also do what's called a test lesion, which is heating the brain temporarily to kind of like a medium temperature where nothing changes permanently, and then testing the patient during that time to see whether the tremor is getting better. If the tremor is getting better and there are no side effects, then we go hotter and make the lesion.
And how long is this process taking?
Overall, 2.5 to 3 hours for the procedure, and it's an outpatient procedure.
So this is always the fascinating part, the show and tell. You actually get to see this really in real time, and you don't have to really wait to see these results. You have patients test their handwriting before, during, and after the procedure. How many times do you have the patient do this test so you know how it's working?
Well, we definitely do it before, at the beginning and at the end of the procedure, and also during. So in the middle of the procedure, as I mentioned, we do that test lesion with the patient awake and, see if their tremor is improving, and we continue to assess it multiple times during the test, so during the procedure. So it might be 4 or 5 times, depending on how many.
You only do one side at a time, as we saw with Rita. She did it in 2021 during the pandemic. Then she came back in 2024 to do it.
Yes.
You do it one at a time. Why is that?
So with the physics of the procedure, the way it works, there's actually diminishing returns. Like the power that we put in through the ultrasound generates the heat at the brain tissue. But the longer we go, the more times we do it, by increasing the power more and more, the temperature doesn't just rise in a linear way. It actually plateaus off. So we would physically run into limitations there, where the more times you're trying to heat the target in the brain, we would lose efficiency and not be able to keep going. So when we're talking about treating the other side, that's treating the other side of the brain as well. So to treat the right hand tremor, we treat the left brain. And then to create treatment for the left hand tremor, we'd have to treat the right brain. The other reason is that there can be postoperative side effects. There's a recovery period that happens after the procedure, and we don't want to do 2 sides at once, because then the side effects can be more difficult to get through.
Well, if you're watching live and you have questions, use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Rita, we saw how those tremors were affecting your daily life. In the clip that we saw here, you're trying to drink coffee, you were trying to use the fork and eat. Was this somewhat of the worst of times that you remember? Kind of talk us through this.
I don't know if it was the worst of times. It was just my daily routine to have to worry about, can I get the cup to my mouth? Can I get the food to my mouth? make sure it didn't fly all over. Did I drop anything? Luckily, I have a wonderful husband who would do anything for me that I ask. And the nice part is he waited until I asked. So he wasn't trying to do too much. But once I had the ultrasound, it was a whole new world.
I bet it was. I saw your husband walking around behind you there this morning. I would imagine family support is really important when you're dealing with something like this. Again, your whole life, when he met you, you were already in the thick of this. What has life been like for him, and what has his support meant for you?
Oh, just everything. In fact, when we were dating, I asked him, would he be able to handle a person who had shaky hands? And he said, sure, I can help you through it. And now it's making me tear up, but seriously, he's been there every step of the way. And now he cheers for me when I carry 2 cups of coffee or do anything, go out and eat in a restaurant. So.
Well, Rita, you're going to make me tear up. I think he wanted to hold your hand no matter what. So I love that. I love that story. So he sounds like a keeper. So you said everything really changed after you had that first session done back in 2021. You came back to have your other side done in 2024, as we mentioned. Tell us a little bit about those experiences. We were mentioning with Dr. Chang and showing, putting the headgear, that halo on, laying down, doing the ultrasound, the MRI. Just walk us through what you remember about that.
Well, honestly, it wasn't easy. It was very loud, even with the ear protection, just like a lot of MRIs. And they suggested I keep my eyes closed, which I did, but it did cause a floating feeling. So I had some nausea, but I just knew that it would be life-changing. So it was easy to know that in 2 hours I would be much better. And Dr. Cheng made it so much bearable by walking me through, and the checks with the tests throughout helped break it up too. So
give you a little bit of relief in there. You did see results. What were you able to do again that you were looking forward to? We see some video here of you getting back to your activities.
Yes, I couldn't cut out fabric at all. My daughter would come over and cut out fabric, and she actually has essential tremors too, but just slightly. And so my sister would pin everything, because otherwise I kept poking myself. So now I can do all of that. I still love them and still want them around, but I can do it. And piano playing is slowly coming back, not near what it was, but it just carrying a glass with water in it, putting a cup to my mouth, things like that. It's just unbelievable. And people notice, my friends notice, my family has noticed, even my voice has gotten better.
You mentioned you retired from your job. What did you do?
I was a librarian, and I always thought that was a good job because I couldn't drop and break books, and so I could shelve the books, and they, it's not such a fine motor skill that I could still do it. And I actually became a director of a small academic library.
Oh, that's nice. A throwback job like a librarian. You don't meet librarians very much anymore, so I love that. But you'd mentioned, dropping the books and things like that. Again, you don't even realize something essential like holding on to something, being so vital for your job. There can be side effects to having this done. Rita, did you deal with any of those?
Yes. Balance is a big thing, and that went away after several weeks. But I've gone through therapy for that, and I had a walker that I used for quite a while. And I just had to relearn how to use my left hand, because I went to an occupational therapist and she said, we need to train your left hand because you haven't used it. And it was so true. I would hide my left hand while my right hand was working these past 3 years.
Dr. Chang, how do you handle those balance issues and help patients manage all that?
Yeah, so balance issues are quite common in the postoperative period, which is worse within the first, I'd say, month after surgery. So we actually counsel people to be prepared for that. People may need to have a cane or a walker available, and some people may need to do physical therapy. So it's expected. So we just want people to be prepared and to just take care in their personal activities, that they're not doing things that are really challenging for balance in the recovery period.
Rita mentioned that her daughter has a slight case of essential tremor. Is this genetic?
Yeah, so often it is inherited. So there are many people who have family history of essential tremor. And there's also people that we treat who no one else in their family has it, but yeah, it can be inherited.
Well, Rita, we always say it's important for patients to advocate for themselves. You're advocating for others, though, living with essential tremor. Tell us about the support group that you started.
Well, through the International Essential Tremor Foundation, Lenexa, they've given us resource help and personal assistance. And so we had, I don't know, it's 15 years, I think, I've started the support group long before I had any focused ultrasound. But we just have meetings at a local library 2 to 3 times a year, and everyone can voice their problems, concerns, coping mechanisms, solutions. And it's different people all the time, so I realize that people need help and need to feel like they're not alone.
And you're doing a lot of work. You were in a recent publication, I understand, correct?
Yes, I authored an article for them about doing the second side of focused ultrasound, because there aren't that many that have had it done. And so with that, and they came and we went to 2 senior expos, and then I'll be presenting again next week. And here in Wichita, we have the Big Read Wichita, and I'm going to present on essential tremor, the unknown disability.
Dr. Chang, how great is it to see someone like Rita, just the involvement, just continuing to do this outreach and to really make a difference with people going through what she's going through.
It's wonderful, actually. I'm glad that, I can point to her for other patients, because there's always people who are like, well, can I speak to someone who's ever had this procedure done, and or people who just feel lonely because of the isolation. It's nice to say that, hey, you can go to Facebook, or you can go online, and there's support groups.
Well, and just to see her playing the piano again, that must make you feel good.
Yeah,
that has to make you
awesome.
smile.
Yeah.
There's a different but more invasive option for treating essential tremor. It's called deep brain stimulation. Tell us what that is.
Right, so deep brain stimulation is a surgery that we also use to treat essential tremor, where we place a thin wire into the brain, into the thalamus, that same target where we do the heating for the focused ultrasound, and then we connect it to a battery that is placed under the skin of the chest. So this is Dr. Nazzaro doing one of the deep brain stimulation surgeries. He's one of my former partners who's retired now. But you can also do the surgery with the patient awake. There's also sleep options, but in deep brain stimulation, you stimulate the part of the brain electrically to stop the tremor. Whereas focused ultrasound, we do the ultrasound energy that heats the part of the brain to create a lesion to stop the tremor.
Doing that while you're awake, I kind of got stuck on when you said that.
Yeah.
I wonder what that's like.
Well, so actually, people do really well with that. They're sleeping for much of the surgery, but just the part where we're trying to make sure the lead or the wire goes into the correct location of the brain, we like to do testing. Just like Rita did testing for a focused ultrasound procedure, we like to test the stimulation in the OR and see that the tremor gets better. when we're doing the deep brain stimulation surgery.
So how do you decide which patient's going to be better for the deep brain stimulator or the focused ultrasound?
Well, I think a lot of it is the patient's personal choice. So there are two different options that both work well. I'd say that deep brain stimulation has been the surgery that's been around for longer. So we've been doing that surgery for a lot longer than focused ultrasound, which has been around for less than 10 years. And a lot of people, like Rita, like the fact that it's less invasive, and that's why they choose the focused ultrasound. The deep brain stimulation, one of the benefits of that is that there's adjustability there. We're electrically stimulating the brain, and we can, adjust the level of stimulation over time. So that's kind of nice.
Do a lot of places offer focused ultrasound?
So it's been rather geographically limited. Because it's a newer technology, so it takes time for the hospitals to buy that equipment and invest in it. So it is very much growing in popularity, so I think more and more hospitals are going to get the focused ultrasound system. But currently, in this greater region, we're really the only place that has it. I think the next nearest place is in Nebraska, where you can get this procedure done.
Let's get to some questions from our viewers this morning. Stuart wants to know, can you explain what essential tremor is? What's the essential in essential tremor?
So that's just the name of the disease. It's a neurodegenerative process where people have essentially tremor that's initially more prominent when you're doing actions. When you're trying to do something, like what she said when she was eating or when she was actually trying to use her hands for fine motor tasks, the tremor is very much apparent. And this is something that generally slowly increases over time. Many people find that they have hand tremor. Some people have voice tremor, which is one thing that Rita mentioned. There's also, head tremor that sometimes people have, or jaw tremor. And it can run in families.
Jean wants to know, does alcohol affect tremors?
So that's a question that I often ask people when I first meet them in clinic, because it's true that for many people who have essential tremor, when they drink alcohol, there can be a temporary benefit to the tremor. So I've had patients tell me, well, my doctor said to just drink some alcohol, but most people don't really like it. It's not like they want to drink alcohol all the time. But
yeah, that's a tricky conversation.
Yeah, but it can provide temporary benefit.
Okay. Any other foods or drink that have an effect one way or another on
caffeine,
tremor?
For some people, they will say that caffeine can make their tremor worse. A lot of other people will tell me things that, like being nervous or emotional or being tired, can make their tremor worse.
Jeremy wants to know, when the focused ultrasound destroys the targeted tissue area causing the tremor, does that affect memory or anything like that, or just burns out some pathways and your brain adjusts around it?
So it creates a very small focused lesion right in that area of the thalamus. And there's not much written in terms of studies reporting cognitive outcomes from focused ultrasound. We have observed in the, so we've treated about almost 300 patients at KU with this procedure. And there's been a small group of patients who've had some cognitive worsening after the procedure. And these are people who had dementia or early dementia, prior to surgery. So it can have cognitive side effects.
Amy wants to know, Rita, did you notice any major differences on your procedure days, or was it pretty much the same thing?
Are you talking after the procedure?
Yeah, just during, or any of it, before, during, and after. Anything different from one side to the next?
Yes, as soon as I had it, it was apparent. I could hold my hands out flat and they weren't shaking. So it was immediate.
Very exciting. I bet that, yeah, that must be nice. Tiffany wants to know, is focused ultrasound covered by insurance?
So yes, it is covered by Medicare. In general, we haven't had too many issues having the insurance companies cover this procedure, but there's been a few times where an insurance company will deny, and then if that happens, then we usually step through whatever processes are necessary. I might do a peer-to-peer or write an appeal letter to the insurance to try to get it covered. That's kind of common when there's a newer procedure, because sometimes insurances will say, okay, this is experimental, it's considered experimental, which is not. I mean, it's FDA approved and it's not considered experimental. So there's been a few times when we've had to kind of fight the insurance companies to get it covered.
Can focused ultrasound treat other kinds of tremor or anything else?
It is also FDA approved to treat tremor related to Parkinson's disease. So there's also patients who have tremor in Parkinson's disease who have undergone this procedure successfully to treat tremor as well. And I believe there are some other applications that are not neuro. Ablations in other parts of the body, maybe for cancer. I'm not actually sure though, because I haven't personally used it for that.
Cindy wants to know why Rita's tremor started so early. Is that something that starts so early, or is there a typical age when that might start, or when people might need to start looking out for symptoms?
Well, so there are some people like Rita who have it during childhood. Many people also mentioned that they had it when they were, in college or something like that. I would say the typical age range of people who are seeking treatment for tremor is often people who are in their 70s. So people who are undergoing focused ultrasound or deep brain stimulation. Many people are in their 70s, but many people like Rita have had it for many years.
So you're saying that people go that many decades before they finally seek treatment? What other treatments are they seeking before that? I know she mentioned medication. Is that
yeah?
Really
so medications would be the first line. So things like primidone and propranolol are first line medications for treatment of tremor. And then there's also things. I don't know if you noticed that when she was in the video, she was using it looked like a weighted utensil, like that fork was just thicker. So weighted utensils or things like that to try to help. There's also something called the Calitrio bracelet, which is like a bracelet which delivers some local electrical stimulation therapy. There's things like Botox injections, which there's some clinical trials to use that.
And I would imagine it's just case by case. It works for some, it doesn't work for others.
Yes, exactly. So some people who come to me, so you notice she said that she's been on propranolol, she started at a low dose and then ended up at a really high dose, or people come to me where they've been on multiple medications and things weren't working, and then that's when they eventually said, okay, we need to seek a surgery because the medical treatments aren't working.
Dr. Chang, for those watching and listening today, what's the big takeaway?
I think the big takeaway is that if you have essential tremor, you don't just have to live like that, like making those accommodations or being afraid to go out to eat because socially you're being embarrassed by the tremor. There's definitely other options out there. So see a neurologist. And if other treatments aren't working, you can be referred to a center like KU or another center that does focused ultrasound.
Rita, thank you so much for being with us today and sharing your story. What's the big takeaway from your story? What do you want people to know?
Kind of like what Dr. Cheng said, you're not alone when you have ET. There's help everywhere, online awareness groups, and just people who are willing to say go see a neurologist. And ET doesn't have to be permanent.
Well, again, thank you for sharing your story and continuing to get the word out. We appreciate you.
Oh, thank you.
Thanks for being with us today. Thanks to both of our guests. Thanks to all of our viewers, and we'll see you back here tomorrow. Don't dwell on your lifespan. Focus on your health span instead. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Here, experts on aging and longevity share advice for keeping fit and independent during the final decades of our lives. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.